Hello and welcome to Mommy Dentist in Business podcast. I'm your host, Dr. Grace Yum, and I just want to say that I literally just got back from a 2-week vacation with my family, and I am excited to get back on with my work and my recordings and this podcast. This has been one of my favorite things to do for the past 8 years. We drop an episode every Friday, with the exception of Christmas and New Year's and Thanksgiving. So I just want to say that this is like one of my favorite things to do. And we have listeners from all over the world, 44 countries to be exact. And it's not just for the mommy dentist, it's for all of our dental community. It could be any dentist, hygienist, dental team member. And if you're listening and you feel that this episode is something that resonates with you and someone that you know that would appreciate the content, please send it to them and have them listen, because I'm excited to showcase one of our very own official members, mommy dentist, Dr. Samira Shafaee, who's also local to me in the Orange County area. She is the co-founder of the T1D Oral Health Foundation. Welcome to the show.
Thank you, Grace. I really appreciate you having me.
I am very thrilled to have you, and I want our listeners to get to know you. And if you can tell them just a smidge about yourself, what you do, and how you got to where you are today.
Absolutely. Thank you. So, I am a general dentist. I am located here in Orange County, California, in Irvine, heart of Orange County. I actually do practice with my husband. My husband is also a general dentist. We met at UCLA School of Dentistry. We have been on this amazing journey together for the last 25 years, and it's been wonderful. We've got two kids. My son just graduated high school. My daughter is starting high school. So, as you can imagine, life is incredibly busy.
I feel like that is so just wonderful that you and your husband are, and I met him, and you two are both
Oh,
wonderful
thank you.
people. And I'm sure your patients just love you. And I know you're doing really great things. I would love to talk more about your T1D Oral Health Foundation and what is that? What is the work your organization is doing?
So a little bit background with that, if that's okay. So my husband and I, we had one practice together. We were in the process of building out our second practice. We were going to transition over, and it was a brand new building, and all the stresses that comes out with building out a new practice. And at that time, I was pregnant with my daughter. My son was a rambunctious toddler, and in the middle of all this craziness with the build out and the kids and all of that, he starts feeling really poorly and just really deteriorating, going back and forth to the doctors. They couldn't figure it out. And at some point, he gets a diagnosis of quote unquote diabetes
Hmm.
and, starts on metformin, dietary controls, all that stuff. He's just perishing away. And, and somebody at some point decides to run a blood work. They do an antibody test and they realize it's antibodies against pancreatic beta cells, which is a diagnosis of type 1 diabetes, not type 2. Completely different processes. And I know we kind of get into this umbrella of saying diabetes is diabetes, but they're not. It's just very different. So then they start him on insulin. And by this time, our daughter was born, again, the toddler, and we were moving to practice, trying to unload the other one. So this poor man did all of this by himself while I was busy with the kids and
Mm.
everything else. And he learned how to manage type 1. I know, in retrospect, I feel very absent from that point. Fast forward, our daughter is 11, and you start noticing she's drinking a lot of water, and she's got a bladder of a camel, and she's getting up to go pee. And your mommy instinct kicks in. I'm like, something is wrong. This is not normal. We've been through this. And sure enough, we do get a diagnosis of type 1 diabetes. And in
Mm.
children, it comes on very fast. In
Mm.
adults, it's a little bit of a slower pace, so it's not as
Mhm.
dramatic.
Mhm.
With her, we were very fortunate. She did not end up in diabetic ketoacidosis, DKA, which is terrifying, and that's how a lot of these kids get hospitalized. She was still hospitalized. We were there for about 2 nights, 3 days. Um, But, it's an autoimmune disease. And, what are the chances? We have 0 people in the family who have this, and now we have 2 people in the family who have this. So
Mm.
we have been um, just just living with type 1, 2 out of 4, and it's very scary. But with my child going through this, and you kind of your eyes open a little bit more. This is a disease where sugar is literally the medicine and dentistry is absent from this conversation. And the misconceptions and the misunderstandings are so profound. And that what led us to establish T1D Oral Health Foundation to bring dentistry to the table in type 1 diabetes care.
That is a very important discussion. Now, me being a pediatric dentist, I have seen children with type 1 diabetes and the concerns, having that conversation, especially when they have to have sugar of some sort in the middle of the night,
Yeah,
when they have their pumps with them at all times, it's it's a shock to the parent at first, right? Like
yeah,
for any parent,
yeah,
especially. And when you first got that mommy instinct and then went
yeah,
for the diagnosis, I'm sure you just started to like really read and research and dig in,
yeah.
and you noticed that dentistry was not as present at the
Yeah.
table with T1D. You must have had so many feelings, Tell me about what you were feeling.
100%.
What were you feeling like? Obviously concern and worry.
Yeah.
But what was the number one like knee-jerk reaction when you found out?
When you're at the hospital and you're getting this diagnosis, there is this parade of providers that come through. And they have a list. They won't release you from the hospital until you know all of these things. And this includes what is diabetes? How do you dose insulin? Because, for this many grams of carbs, you need 1 unit of insulin, and you have to take it this much before. And there's this whole rules. And you have, of course, pediatric endocrinology come through, check. You can have
Mm-hmm.
nutrition come through, check. Various pediatric specialties came through for us with my daughter. My husband wasn't hospitalized. But all of these people come through, and you get like pamphlets and brochures and people asking you, do you understand? And this includes anything from kidney disease to diabetic retinopathy to
Yes,
diabetic foot.
eyes, foot,
All
yeah,
of these
gangrene.
things are
Yeah.
chronic. The minute you go home and that child has a low blood sugar at 2 a.m., you're shoving candy in their mouth. So
Mm-hmm.
why is there no information given to families at
Mm-hmm.
diagnosis regarding something so acute? And I found that very surprising. So your initial knee-jerk reaction is, it must be our hospital. It must be my area. And then you start talking to other people and you go to support
Mm-hmm.
groups. Nope, 0. And it's just kind of a disappointment in our own profession for me a little bit. And that
Mm-hmm.
was the motivation. Okay, if nobody's doing this, I got to do this.
Mm-hmm.
I can't possibly be the only parent of a child with
Mm-hmm.
type 1 diabetes. And so,
Absolutely. Well, back in Chicago where I practiced, I was involved with a lot of my patients with the Juvenile Diabetes Association and
mhm,
fundraising and all of that. And I've had employees at my dental practice where their family members have type 1 diabetes, and navigating that is a lot, right? And
absolutely.
it becomes all consuming because it affects so many of your organs and your
Yeah,
entire body. And
yeah.
I think that, again, when hospitals and all of the specialists are throwing pamphlets at you, you're not going to sit there and read all the pamphlets.
No, no,
Yeah.
no.
And so you're just kind of like, okay, thank you. And you're shoving it in your bag or your backpack
Yeah,
and then trying to absorb it, but you're looking at your child like, oh my goodness, right?
right, right.
Um, and I think probably you're like, okay, now there's equipment with this, and now there's medications with this, and now there's all of these things. And it's like you said, hard to find the information and get the support group and the network that you need and the community that you need And when you went to find that community and they agreed that there wasn't enough support, it sounds like you and your husband decided we're going to do it. We're going to create this support network, especially because of our child. Now, what was the communication like with your child? I mean, when it happened, she was 11 years old. How did she take this?
I mean, you got to remember the psychosocial component of disease is so huge. It's like, and I think there's data from American Diabetes Association where it says like 40% of these kids suffer from some sort of eating disorder at some point because food and an insulin injection is forever linked. And
Right,
so, and that's not something we learned about in dental school, right? We learned
right.
about all sorts of eating disorders. This was not covered. And just a mental component. So her first knee-jerk reaction was just crying, I don't want this, because she sees
Yes.
her dad. And
Yeah.
so, but I'm sorry, kid, this is life. And so a sense of you have to learn to accept it. And okay, how do we go from here? And she
Yeah.
is a tough cookie, let me tell you. This child is incredibly resilient. She makes me proud every single day. But it's hard, man. It's really
It's so
hard.
hard. It is so hard. I mean, 11. She's probably
Yeah.
like, why me? I don't want this.
Oh,
How do you get rid of it? Like, I don't want
well,
this anymore.
Well, kids don't want to be different, especially as you approach teenagehood. They don't want to have the wrong color hair. They don't want to have like the wrong clothes. And then yet, as you know, with type 1 diabetes, especially wonderfully now with all the technology, now you got like robot parts stuck on you,
Yeah,
just so
yes.
you can function. So, how do you navigate that? And
Right.
with her, she's not doing an insulin pump. An insulin pump, if anybody has seen it, is a little bit larger than the size of a
Yeah.
Tic Tac box.
Yeah.
It's filled with liquid. You have to change it every 3 days. And so she's like, I don't want to walk around with that. She plays tennis. She's an active kid. So she's just doing insulin injections. So imagine, multitude of injections every day. Then you start bruising, then you start
Mhm.
developing callousing. Pick your battle. But and I've heard this argument like, oh, we're so lucky, and we are, that there's so much technology, but it doesn't make it go away.
Right.
It makes it more streamlined, but like the insulin pump can't guess whether you can have a burger at this point or not,
Right.
you
Right.
know?
Right.
And so very grateful for that we live in a country where all these things are available to us, but the challenge is still there.
The challenge is still there, but it's also very stressful. It's stressful
Oh, yeah.
for everyone, the parents, the child, especially when you're not there to observe, right? And
Yeah.
then the school has to be notified,
Yeah.
and I know that with children middle school age, they don't want to be different or stand out at all.
Yeah.
And so that is like another, like you said, psychosocial component
Huge.
of for the
Yeah.
child and having to now all of a sudden be responsible, right? And
Well, that's interesting that you said that about the school because and I get like school to school there is variability, but when you have the meeting with the teachers and everything, one thing they did not want us to do is they did not want her to do an injection in the classroom. Well,
mm,
you got to remember she's got a pre-bolus. She's got to give herself insulin about 15, 20 minutes before she eats, maybe
yeah,
10 minutes. So they want her to go to the office. So she has to get up from her class to go to the office. Well, not every kid wants to do that. You
right,
know what I mean?
right.
So then she just doesn't dose. Then all of a sudden the blood sugar is plummeting or skyrocketing depending on how things prior went. And she's crying and she's like, the school is more concerned about me sticking another kid with a needle than my health. And that's like, yeah, kid, I'm sorry, but that's just how it is.
Yeah.
And so, yeah.
It's so hard. It's so hard for all of the
Hmm.
kids,
Yeah.
and circling back, right, to dental professionals and what we
Yeah.
know and we don't know. And again, there are a lot of general dentists that treat children,
Yes.
and maybe not at the volume in which specialists treat children,
Yeah.
but at some point they need to. And pediatric specialists, we do get training, obviously in
Yes.
in all of
Oh,
these conditions, but especially for those who don't, what are some of the biggest misconceptions or misunderstandings that dental professionals have about type 1 diabetes?
so one of the things we did with T1D Oral Health Foundation is we created a little questionnaire for families to fill out. And, you know, initially when we went into this, we were like, oh, yeah, we're going to talk to families. I'm going to empower families. And then when the families started giving us feedback, we realized, oh, shoot, the problem is that the dentists don't even know. So we were hearing things like, my dentist says, why are you giving your kids sugar in the middle of the night? Why don't you give them xylitol? And it's like, no, xylitol doesn't increase blood sugar. A lot of just misconceptions about sugar. Well, have you tried this? It's like, no, you cannot get cured from type 1. And I know in pediatric dentistry, there is a little bit more education around it. I don't think GPs have that same level of education. So it was just a lot of misinformation. Or, why are you not brushing your kids' teeth in the middle of the night? Like, the kid is hypoglycemic. I'm half asleep. The kid is half asleep. I'm just like shoving stuff in their mouth just so she doesn't pass out or get a seizure. Nobody's thinking about oral health at that night. And dentists are nice people. We are good people. So I don't think any of this is meant to be said in a condescending way, but it lands poorly. It really lands poorly. So then it creates a situation where two things are happening. Either they are just not putting type 1 on the health questionnaire. And initially, when I saw this, I thought, oh, okay, it must be just this mom.
Mm,
And then you keep talking to families and it's repeated. And it's just
mm.
because they had so many conversations of, why are you doing this? Why don't you do that? And they're like, you know what? You don't need to know. You're my dentist. Just clean my teeth. And that's really unfortunate. Um, or the other part of it is that, if they're so overwhelmed and there's so many moving parts, they will drop dental care. They just
Mm.
won't go,
Sure,
you
it goes
know?
to the side. And I think that again, what I've noticed with any child that has any kind of medical need, right? Whether it's
Hmm.
diabetes, autism, cerebral palsy, Down syndrome, you name it, the
Hmm.
dental oral care, children who have hemophilia, children, cancer, the dental component is often the lowest on the totem pole,
Yeah,
you know?
yeah,
And what's interesting to me though is that when they do need something, right? If they need to go under surgery or IV, some kind of procedure,
yeah,
they don't get cleared if they have a cavity
yeah,
because that
yeah,
bacterial count in the tooth, if
yeah,
they have low T cells and low immunity, can actually cause more problems. And
yeah,
so we educate our patients. We understand that you have this, and this. But if you are not taking care of your children's teeth and you think they're primary teeth, they're baby teeth, who cares? It is wrong
yeah.
because that bacterial load in the mouth can affect your overall health. And so with all dentists, whether it's general, pediatric, holistic, whatever, it's systemic. It all starts with the mouth that affects the rest of your body. And so it's all connected. And it's very important that dentists and all of our colleagues are fully aware of every patient's systemic health. And I
Absolutely.
and I do always get parents who are overwhelmed. They don't fill out the health history to completion.
Yeah,
And so a lot of times it's not the fault of the provider because the parent or the patient doesn't even fill it out. And
oh yeah,
they might think, well, why does the dentist have to know, to your point? Just
yeah,
I'm here to clean my teeth. But no, it is our job to say, is your health history form completed to
yeah,
your knowledge? It is
yeah,
our job to investigate. I know you handed this in to me. I know I see it and I read it, but let me go over this one more time. Are you positive? Because if this isn't checked out, and what's the purpose of a health history? Why even have it then? Why even
yeah,
ask about it? Right? But it
yeah,
all ties in. And that's why it's so important that the health history form is reviewed at every visit because things change. Your daughter was diagnosed at 11
yeah, yeah,
and they go in every 6 months to the pediatric dentist, or they should be. And if that pediatric dental office isn't checking that review history, reviewing it, they will miss it.
yeah, yeah. But I mean, it's to your point. I think the pediatric dentists are amazing at that. Keep in mind, these kids do grow up. As of year 2000, about 50% of cases of autoimmune diabetes diagnosed are over the age of 18. Nobody really knows why that shifts. So the term juvenile diabetes is being phased out. It's now called autoimmune diabetes or just type 1, or if it's later in life, it's 1.5. So these kids do become adults and or the adults that are diagnosed. So this population is being seen in a GP practice. And even though the pediatric dentists have been the ones historically that have a lot of information, the GPs are not getting the training that they need. So when they hear type 1 diabetes or autoimmune diabetes, the first thing is like periodontal disease, xerostomia. But what
Mm-hmm.
about this like multitude of assaults on the teeth every single day? You're looking at enamel demineralization, you're looking at decay. And
Mm-hmm.
if they are, again, the psychosocial component, if there's a little bit of depression involved, if it's like a teenager with ADHD who's taking medications, or maybe they're an adult and they're on cardiac medications, they have xerostomia and other things that are compounding the problem. I mean, you can see this can go south really fast. And so
Yeah.
when the dentist comes back and says, "Hey, why don't you take xylitol?" And they're like, "Whoa, like you're not." Like, what do you mean take xylitol? This isn't
Right,
going to work.
right,
So
right.
again, it just lands poorly. And so it's a hard thing to navigate. It's
It
just
it
hard.
really is, and I'm so glad
Yeah.
that you and your husband are bringing this to the forefront for our colleagues to have that understanding through the families that you have been working with, and the conversations that you're having about type 1 or now autoimmune
Mhm.
diabetes in your community. What are some important insights that you've gained that you would like to share with our listeners?
So the insights have been that they're like, for example, we have on the questionnaire, it has information and parents and families fill them out. So I had one lady who said, "Oh, our dentist told us that if they had a teenager, when the kid gets up, they should sip a little bit of water before going back to sleep." I'm like, "Oh, wow, that's really good advice." He's like, "Well, he doesn't like drinking water, so he kind of sips with a little bit of mouthwash, and I have him spit it out." And initially, my thought was like, okay, but then you kind of look in, and he was actually using like the blue alcohol-based mouthwashes, and
Mm,
they run at a pH of 5.5. So
yeah.
now you just gave this kid like a bunch of sugar, and
Aesthetic environment. Yeah.
acidic, and so now you're making it worse. So I think because it's not broken down in very simple steps, the advice might be as not clearly
Sure.
communicated.
Sure.
And I will give a shout out to ADA, American Dental Association, and NOLA, National Oral Health Literacy Alliance, is working with me to create a pamphlet to give to families through endocrinology offices, and I'm very grateful for that opportunity. But my part of it is talk to individuals like you who have an amazing platform, and other places is teach dentists, hey, this is what a lived experience with type 1 looks like.
Mm,
So the advice given has to reflect a reality that might not be as simple as, oh, don't have sugar and floss your teeth all the time. You know what I mean? It just
yeah,
needs to be a little bit more realistic.
absolutely. Well, considering that you're working with the ADA to get this information out and you're creating this information, what is something that every dentist should understand about living, like you said, living in the realities of type 1 diabetes? What would that be?
Well, the first one would be that sugar is not optional. We are so set on having this conception that sugar is a modifiable risk factor. And everything is like, it kind of revolves around that. But this is not an option.
Mm,
If my child is playing sports and her blood sugar crashes in the middle of it, yes, we're eating a gummy bear or a Jolly
mm,
Rancher. She's not
sure.
sucking on candy just for the fun of it. And so I think the first thing I really hope general practitioners and pediatric dentists and orthodontists and anybody involved in treating this population is understand that this is not a modifiable risk factor. Just accept that this is going to happen. The advice has to revolve around that. The other thing is I had somebody tell me, well, if you don't feel comfortable treating this population, you should refer it out. And my response
Mm,
was, it's who are you going to refer it out? It's
mm,
not a complicated root canal. You know
mhm,
what I mean?
mhm,
And
mhm.
so everybody needs to know how to communicate and manage. What do you do with hyperglycemia, hypoglycemia, if there is an episode in your office? Um, I mean, at the end of it, it's going to be a bunch of class two fillings and like, cervical lesions. And then if it compounds, obviously, more extensive restorative treatment in hope of not getting to a point where it's terminal dentition. But none of that is something you refer out in that
Right.
early stages.
Right.
So yeah, education is key.
Well, looking ahead, what is your vision for the future of T1D and oral health care?
Well, the two goals is just to make sure our pamphlet or our information for families is out there. Just being on a lot of these Facebook groups where families kind of ask each other questions, and you kind of dig in and you see the questions being asked are the same questions repeated over and over again. And they're coming to these Facebook
Sure.
forums because they're not getting the answers they want at the
Right.
providers they go to. So
Right.
my first thing is to have the information out there. And I think distributing widely a pamphlet or just some sort of information that's available online that parents can
Mm,
refer to is going to be big.
sure.
And then, of course, the second one is for all dentists to understand what is a lived experience. We all know beta cells get destroyed. You need exogenous and insulin to live. But what does that mean in a 24-hour period?
Mm,
I don't think unless you come face to face with it,
mhm.
that's fully understood.
Right. The mechanics of it, the science
Yeah.
and physiology of the body. Now, for the practice, for practitioners, how for everyone listening, how early can you see the onset at what age of T1D?
Well, T1D can happen at any age. I think the youngest in literature I saw was 6 weeks old. And obviously, it can go on to adulthood, as I said, at this point in time, whether it's better diagnosis or maybe there's something environmentally, but we're seeing a lot more adults. So it can present itself at any age. In the true type 1 juvenile cases, the onset is very quick. I think from the time we saw the first sign in my daughter until she was in the hospital was 4 days.
Mm,
In my husband's case, it was probably 2, 3 months. So it was a very gradual destruction of beta cells
mm,
to a point where your body just doesn't have insulin to function.
mm, mm,
So
mm.
that range is quite wide, quite wide.
It is quite wide. And
Yeah.
what would you say is the number one FAQ that your community members have?
What do I do? What do I do? I've had a couple of people say, before my child was diagnosed, like the kid never had a cavity. And within 6 months
Mm,
prior to diagnosis, they noticed a lot of cavities, a lot of,
mm,
and they thought, oh, well, my dentist must be overdiagnosing. But what
mm,
is happening, there's actually an elevation in the blood glucose levels, just like your
mhm.
blood glucose goes up or urine
Yeah.
glucose goes up. So they're basically their teeth are sitting in sugar water prior to diagnosis. So
Yeah.
I couldn't find any literature supporting that. Like nobody has studied that. Or, the other thing that I couldn't find is, okay, if I'm giving my kid juice to elevate her blood sugar versus giving her gummies, is one better for her teeth than the other?
Mm,
Like nobody has looked into these things. And these
mhm.
are going to be lifelong patterns. So it would be
Right.
nice to kind of see what is a better choice.
Right.
Do you
And
know
be
what I mean?
prepared. And as a practitioner, you should have tools in your tool belt to
Yeah.
offer, right? And that
Yeah.
to offer your patients that
Yeah.
is custom to them, right?
Yeah.
Because some families they would prefer the juice, some children will
Yeah.
prefer the gummies, but it's
Yeah.
what do you do after? Like
Yeah.
what's
Yeah.
realistic, right?
Yeah.
Like
Exactly.
what is something that
Yeah.
you can do that's sustainable to
Yeah.
protect your mouth,
Yeah.
right?
Yeah.
And what are we doing here?
Yeah.
Because that prescription is going to
Yeah.
be one less battle, right? Because it's already like when I talk to my patients, it's like, hey, I don't want you to spend all this money fixing teeth.
Yeah.
Right?
Yeah.
So if you do what I tell you to do, you will be saving money. and
Exactly.
and not just saving money, but keeping your child from having
Yeah.
to go through class 2 fillings. And
Yeah.
who wants to do fillings? Adults
Yeah.
don't want to do fillings. You think your kid's
No.
going to want to do fillings? If you
No.
can't even do it, then how you expect your child to do it, right?
Yeah.
So it's
Yeah.
kind of like I'm not trying to scare anybody here, but like if we don't manage this properly, you're
Yeah.
going to end up seeing me more often than you should. And not that I don't love you, I'll see you every time and any time, but I'm sure you're
Yes.
not going to want to see me all the time.
Yes, yes.
Right? You
And
know?
that's a difficult conversation because, like some people think, oh my gosh, greedy dentist, I just want to see me more often. My teeth are fine. I don't have any pain. But then also the other part of it is, in our pamphlet that we're doing, I am very pro fluoride. And yes, you should
Yes.
probably come in if you have a type 1 diabetes child. We tell all the families, go in every 3 months. There's no downside to it. Pay for an extra
Wow.
copay, go in every 3 months. How insurance doesn't, even medical insurance hasn't stepped in to say,
Yes.
hey, this is part of it. That's a
Well, it's
whole different conversation.
prevention. It's
It's
prevention.
prevention.
It's
It's
prevention.
prevention. Yeah.
But the child's already going through so many
Yeah.
psycho emotional feelings. Why add to that? Right?
Yeah.
So if it's
Yeah.
an extra two cleanings a year, why not? And it's
Yes.
like, hey, prescription fluoride toothpaste, right? Like
Yes.
floss.
Yeah.
I might say, let's just put SDF in there,
Yeah.
right? To ward it
Yeah.
off, right? There's all these things that we have that can make this
Yes.
so much easier. But the thing is, it's educating. It's
Yes.
our part in educating, right? Because we're
Yes.
not coming off as the greedy dentist. We're coming off as in, I am partnering with you to
Yes.
maintain this and to do one less thing, right?
Yes.
Let's just do one less thing to your child
Yes.
because believe me, and when with children, we have to do quadrant dentistry
Yeah.
or half the face. We can't numb the whole face. Like you don't want that for your child, and I don't want that for your child. And so it's all really in how you present, how
Yeah.
you educate, and that I feel like should be part of the dental side of education, right? Like it's
Yeah.
the conversation and what is in your office that you're going to offer and having that discussion. And I think that starting this conversation is so important. And then realizing the lived life of that patient and meeting them where they are and being understanding because the parents are overwhelmed. The parents are like, I don't know what to do. And it's just one more thing on their plate. And they have so many
Exactly.
appointments already, right? They have so many doctor's appointments already. Why throw in dentistry more than it needs to be in there?
Exactly. I mean, if you can take one thing off of their plate, why not? And I get it. It gets challenging. The whole conversation around fluoride, we still have it, but it's getting a little bit tougher every year. But we
Yeah.
show up, we do the best we can, and
Yep.
we go from there. Yeah.
Well, thank you so much, Samira, for this conversation. It was very
Thank you.
educational and lots of great highlights in this episode. I'm going to leave you with one last question because you are
Yeah.
doing a lot. What is your number one piece of advice on how you're balancing your professional and personal life and T1D?
Well, I'll be honest with you, I have not figured out and how to balance all of that. I'm pretending would be dishonest otherwise. But, balance is important, but also balance is not static. Certain weeks the kids need me more, certain weeks the practice needs me more, certain weeks the husband needs you more, and certain weeks the foundation needs it. I mean, it's not static. And I think we all get in this mindset of balance just means a little piece of everything every day. And it's not.
Absolutely.
And so once I figure that out, I will let you know. But what really keeps me sane is having an understanding of why you do something. Why do I show up for the kids? Why do I show up for my foundation? Why am I recommending whatever as far as treatment wise to my patients? And so once we understand the why, I feel like it's a little bit easier to navigate that balance.
Absolutely.
Yeah.
Well, thank you so much again. And for listeners, I'm just really excited for you to keep on learning and really stay educated. And if you want to reach out to Dr. Samira and find out more, Samira, what is the foundation's website?
So the foundation is a nonprofit, so it is a .org, but it's T1D Oral Health Foundation.org. So there's an email, contact us. You can reach me that way anytime.
Perfect. Well, thank you again so much. And
Thank you so
again,
much.
I will see you at the Social Summit for
Yes,
any of
I'll
our
be in
mommy
DC.
dentists. Yeah. And you know what? The Social Summit is our main conference. And it is, I think yes, sorry for a second. I thought the recording button went off, but our
Uh-huh.
main conference, annual conference, we have always between 300 people that show up. And this conference is going to be in Washington, D.C. It's not too late to come. Associates are welcome. And mommy dentists, if you have friends that are not mommy dentists, they're also welcome. We have mommy dentists bring their adult daughters who are in dental school. And so we open it up to all the women in dentistry who want to join. So you're more than welcome to join. You can go to our website at mommydibs.com, and we will see you there in September. And Samir, I will see you there. And what do you love about being in our community? Speaking of communities, what has been one highlight that you have taken away from being in the MDIB community?
Oh my gosh. I think I became an official member, I think the first year you had this, and it has been amazing. Every question from practice management to children, if I have a question, I'll just get on there and type it up. And the next thing I know, I have like 12 answers from various perspectives. And I'm like, where else do you get this? And, and it's funny, my staff make fun of me. Anything that happens, oh, my mommy dentist group said this, and they are getting so tired of me saying this. And the other day, my husband is like, can you stop saying that, please? So even if I'm
Oh,
not asking a question, I'm like reading other people's questions, and I've learned so much. And
same.
that's just a true sense of community. And I
It
love
really is.
that. And thank you, Grace, for bringing that to us.
Oh, my pleasure. I've learned so much through the years as well. And the original intent, we just had our ninth birthday on June 17th. And
Oh,
so
happy birthday.
thank you. It's our ninth anniversary. And when I reflect on what happened 9 years ago, the intent really was for business owners. The intention was it's a group for business owners. And then we realized that many business owners were both associates and business owners. And then in that interim of time over the 9 years, a lot of business owners then sold and became associates. And so that's become kind of a looser term, but we
Mhm.
can't negate that experience, right? Like for
Yeah,
those who own for 20, 30 years and now are like, you know what, I'm just going to sell and become an associate. All of their lived experience, talking about lived experience, right? Like
100%.
it's
Yes.
all still a part of it. And so we have learned so much together, and that's why this community has been a lifeline
Yeah.
to all of us. And I'm so glad that you're a part of it, and I'm so glad that you're so local to me, and
I
that
know.
I get to
I got
see
so
you.
excited when you moved to my neighborhood.
I know, me too. I was like, oh my God, this is so great. And which reminds me, I have to reach out to Hanya because we need to get our Orange County get together soon.
Yes, we should.
Um, but on that note, I am going to say thank you and thank you for sharing with us all about your foundation, your nonprofit, all the good work that you and your husband are doing.
Thank you so
And
much.
I am so, so proud that you are one of our members and just creating such a great future for our dental profession. So thank you for that. And listeners, if you
Thank you.
love our podcast, give us a 5-star review on your favorite platform. And this is a CE eligible episode. And so if you want CE, it is free for our official members. And if you're not an official member, and let's say you're a hygienist or a male dentist and you want CE, you can also pay a la carte for it. So that is all online. And we will see you next time. Thank you, everyone. Take care now.